So welcome back. Before the break, we were talking to Dr. Paul Serhal about all things to do with fertility and egg freezing, so many different things. And now we're looking at something even, well, to say quite as interesting, I've never heard of before, fertility massage. So joining me, I've got Launa Blackham. Have I said that right? Blackham? Yeah. And you're an osteopath and a fertility massage practitioner. Now, I've never heard of it before. Okay. What is fertility massage?
So fertility massage is a massage which is done directly over the reproductive system. It's very holistic treatment. Okay. It takes about an hour usually.
Okay, well we haven't got an hour.
No.
For our Diane. I've never heard of this before, so how long has it been practiced or been done?
It's fairly new. It's just been founded really recently by Claire Blake. Okay. She's just started teaching it. She's just going global with it now, just about to start teaching in Australia. So really the amount of practitioners is just starting to boom now. Okay, so what is the whole purpose of it? What does it actually do? So to encourage the blood flow, so we really want to start releasing some of the tissues, relaxing off the muscles, ligaments, fascia, that's all around the area. Okay. This helps with the blood flow and it helps with congestion in the area, with the neural nerve input. Okay. Working on the back is because the nerves that supply the digestive system and the reproductive system exit from the back, and also the sacrum as well, which is your lower part of your back, your tailbone. Okay. And this helps to bring circulation again, nourish the tissues, and also if you've got good circulation, then you've got good hormone delivery, which is vital for fertility. And doing the massage on the digestive system really helps with getting the peristalsis going, which is what you want to encourage the best nutrient absorption. And also a lot of the immune system resides in the digestive tract. Okay, you said that, I've got to say it again, peristalsis, so it's the movement of the gut, right? Okay. As it puts all the the food through your colon, your small intestines. Okay, it's the movement. Okay, so you're going to be demonstrating on our lovely Diane here today. So as you are doing it, because we're not going to be able to see all of her stomach, if you talk us through exactly what it is that you'll be doing. So if you want to get into position. And we haven't got an hour for you, Diane, but we are going to listen and you are going to experience it. And I think that it's written in the clause that if this works, we get to film the childbirth as well. I'm joking. Okay, go ahead, Laura. Okay. So what's that you're putting on her stomach? So this is massage wax. Okay. Oh, massage wax. I've never heard of that. Massage oil I've heard of. Yeah, that's a solid form. So really you start off by just doing some gentle relaxing massage, because it's an area of your body which you're not really used to having touched. Diane, you haven't got a microphone on, but how does it feel? And I can kind of like say so.
It feels quite relaxing actually. I thought it was going to tickle me, but I'm very ticklish, but it's not tickling me at all.
So it's quite relaxing, not tickling. So when is normally like the best time for this kind of treatment? Is there a best time, or can it be done any time?
So the best time really is if you're actively trying to conceive. You really got to have it after menstruation and before ovulation. So this is a quite short window of time. Okay. So what we do in a fertility massage session is we teach people how to do the self-massage on themselves, so they can really make the most of that time. Okay. So how many times in that short window should this be done? Well, I'd recommend having at least one from a fertility massage practitioner, and then maybe doing it on yourself every day up until ovulation. Okay. So during a session of fertility massage, you'll also get taught how to chart your own ovulation. Okay.
Can I ask a question? I haven't got my mic on, but maybe Lisa, you can ask.
So yeah, Diane's going to ask a question and I'll be able to help with that.
After this, the massage treatment, what's the percentage of people actually conceiving?
Okay, good question. So after the treatment, what's the percentage of people then that conceive?
I think it's not a guarantee that you're going to conceive. It's more to aid fertility. Okay. What we're doing is encouraging blood supply, you want to improve the environment really to optimise the chances rather than guaranteeing a pregnancy.
So is it people that are struggling to conceive, or just people that just generally want to conceive that come and see you?
Yeah, wanting to conceive, it can be preconceptual care.
Okay.
So ideally, I mean, having 3 months really before you actively try and conceive, you're really getting the body ready to have a baby, to, you know, being able to optimise the environment for a fetus, for a baby. And also with, sorry, I forgot what it was.
I was going to say, it's something that you use in conjunction with other kind of therapies. So I think, like as we spoke to the doctor earlier, so about a balanced diet, looking after yourself.
It's really key to see a nutritional therapist, naturopath, and maybe even a herbalist as well, I'd recommend. Changing your lifestyle. Depends on each individual and how they're living, really.
Okay. So now, what is it? I mean, is there the method that you're using? I mean, is it kind of? Do you want to like kind of say what it is exactly that it is you're doing? As in where you're massaging now.
So at the moment, I'm massaging and sort of stretching.
Quite deep into
it. It can be a deep massage, stretching into the diaphragm. This is really important because if you can breathe properly into the abdomen, then you're getting a good pumping action, which is good for circulation and drawing out any congestion in the area.
Another question. Am I meant to be feeling something happening on the inside?
Okay, so Diane, for our viewers at home, is just asking, is she meant to be feeling something happening on the inside?
No, not necessarily. Some people experience gurgling as you're going over the abdomen. But otherwise,
not good. But it does look very relaxing. Is it relaxing, Diane?
Yeah, it's quite relaxing. There was a time when she moved over one part of my body where I felt excruciating pain. And I don't know if that's because this on the inside needs to be
so you've
released or something.
Would that be because if you're doing some kind of like deep tissue massage, sometimes you can kind of...
It could be caused by some tightness in the area, so muscle, ligaments, sometimes history of scar tissue as well that can cause pain.
Okay.
Usually get feedback as you do the massage to make sure that the client's comfortable, really.
Okay, so about how long does a massage normally? I think you said an hour.
Yeah, so it takes about an hour, and you start off really normally on the back, so you massage the back and over the sacrum area, and get some movement going through there with different techniques like pulsing. And
like there where your hand is now, where are you at?
In there.
Yeah.
So this is just inside your pelvis, really, over near the ovary area. But there's lots of connective tissue, so it's quite tender, is it?
Very.
Okay.
Okay, Diane is saying that bit is very tender.
Pressure a bit better.
Yeah, it's not. It's like there's a pain going. It's not the same. Doesn't feel the same on the left as it does on the right.
Okay. Yeah. What you can get is sometimes the womb's in a non-optimum position, so it can be retroverted, anteroverted. So that's backwards or forwards.
Okay.
And also to the sides, and this can put pressure, tightness around all the ligaments and everything that's holding it in place.
So have you had any of your clients that have had this to come back and said that they have then conceived?
Yeah, recently actually somebody's announced that they've become pregnant.
Oh wow! Yeah. So what, I don't know, maybe we could get a child named after you, a middle name or something like that. We'll definitely let you know how our Diane gets on, that's for sure. Okay, so thank you very much for that. It was all very interesting. As I said, we'll let you know how Diane gets on. So we hope that you learned something new today. Now what we're going to do is going to watch our Inspire Me video. So have a look at this.